everyone, and welcome to today's Lunch and Learn webinar session titled Diabetes Clinical Guidelines. I am Shannon Robertson, Interim Clinical Quality Director with the Louisiana Primary Care Association. Our presenter for today is Erin Trudeau, fourth year, Tulane University medical student. During this one-hour presentation, she will discuss the impact of diabetes in Louisiana and the American Diabetes Association's national standards for diabetes self-management and education, and provide information on how to apply these standards to individual practices in Louisiana. Just a housekeeping item, during the webinar, all participants will be in listen-only mode. Please type in your question throughout the broadcast in the chat box or click the option to raise your hand located on the webinar screen and I will unmute your line. All lines will be unmuted after the presentation for questions. If we run out of time, you can email your question and we will follow up with you after the webinar. Our contact information will also be displayed at the end. Thank you for participating in this series. Erin, you may begin.
Okay, thanks Shannon. So today we're going to talk about diabetes and some of the guidelines that the American Diabetes Association has put out. Oops, wait. Okay. So why are we talking about diabetes? Well, with the ever-changing healthcare in the United States, particularly in Louisiana, more and more of our patients are being diagnosed with this disease that affects not only their blood glucose, but almost every other organ in their body. And Louisiana is greater than 10.6% of the population, for the most part, has diabetes. And this also correlates with the obesity, stroke, and hypertension maps that the CDC also puts out. So that's what we're going to be talking about. So here's a closer look at our state. In the U.S., about 29.1 million people are believed to have diabetes, which is about 9.3% of the population. 8.1 million, or 27% of these people, are undiagnosed. In Louisiana, over 500,000 people have diabetes, which accounts for about 13% of our population. And in the about 1.2 million people in Louisiana are expected to be pre-diabetic, and about a third of those people probably will develop diabetes, and 9 out of 10 people in that group do not know that they are pre-diabetic. In the U.S., this number is 86 million, or about 35% of our adult population. The U.S. average for diabetes is 9% of the population. Our county averages is 9.9% of the population, whereas in Louisiana it's 11.7%. St. Tammany Parish has the lowest incidence of 8.4%, whereas East Carroll Parish, which is up here, has the highest at 15.5%, though many of these dark red parishes are in the 14s and 15s percents. So a few of the comorbidity or complications of diabetes and comorbidities are hypertension. About 71% of diabetics have high blood pressure, and another 65% have elevated LDL cholesterol and are on medication. Diabetes with hypertension leads to an increased risk of cardiovascular disease of 1.7 times, of heart attack of 1.8, and stroke of 1.5. Another one of the major complications that we worry about is nephropathy, which is the primary cause of kidney failure at 44%. In 2013, 50,000 people began treatment for kidney failure due to diabetes, and 229,000 people with kidney failure due to diabetes were on dialysis or had had a transplant. So what the ADA is looking to do and is using these 10 standards They want to clarify our role as educators in the process of self-diabetes management for patients. And this applies to both patients with diabetes and prediabetes. And it keeps patients at the center of their care. Those who are actively involved in their diabetes management have better outcomes over time. So taking a look at these 10 standards that we're going to go through individually. The first one is internal structure, external input, access to care, program coordination, instructional staff, the curriculum used, individualization of program. Individualization of programs, providing ongoing support for patients, marking progress for patients, and then continued quality improvement of the system. So, internal structure is about documenting your mission statement and goals and the structure of diabetes care that you're going to be providing, both at an institutional level as well as on the patient level. So you want to be creating clear communication when you're talking with patients, but also with everyone in your staff to make sure that you're on the same page on how you're managing diabetes at your institution. You have to be committed to educational progress and using measurements to make sure that you're reaching your goals in some way. So these can include, measuring A1Cs to figure out whether or not you're meeting goals of lowering them in your group on individuals and as a practice in general. And then, formulating the way that you discuss diabetes or discuss anything with your patients and making sure that they feel open to talking to you about what you're doing. So this can be as simple as changing the way that you phrase questions, like, do you have any questions, and opening it up as, what questions do you have? Because that way you're opening up the lines and saying, like, even though it's just a simple change, patients can see that, it's okay to ask questions and be confused, because there's a lot of different things that play into their disease, and you want them to be actively involved and not discouraged. So external input is about getting community stakeholders, patients, providers, different interest groups involved in your program's effectiveness. So these can be anything from churches or schools, community centers. Grocers are another really good place because, food and eating and nutrition are incredibly important in the management of diabetes. So, making sure that you're involved in places where people are going to be and where you can have an impact on people is important. So outside groups can help you better identify what the issues of your local population are, and ensuring that you're staying in a patient-centered manner and keeps you appealing and relevant to your community. So access, many times the issues that come up is that, like, transportation or other issues are what are more the social determinants of health that limit people's ability to get the best care for their diabetes. So you want to be able to determine who is missing out on service and what you can be doing to reach out more to them, and identifying your weaknesses and figuring out ways to increase support. Program coordination is making sure that you have someone that is overseeing your education program and being accountable for patients and making sure that all of their needs are cared for, and that, everything from what's going on at the front desk, what happens for when the medical assistant is taking vitals to when you're at the lab or the pharmacist, making sure that all care is coordinated around each patient. Part of this is the instruction, and one of the things that the ADA recommends is getting a certificate in board from the Board of Diabetes Educators. They have information on their website where that you study from, and then you can go and take the exam at various testing sites across the state. And that's available to any provider, so you don't have to be a doctor or a nurse. It's open to, you know, dietitians, pharmacists, anyone that's in your program, and using the knowledge that they learn to bring back to your site. So you want curriculum. You want to make sure that you have a wide variety of things that you can talk about with your patients, and using making sure that you have like a checklist of things that you want to make sure are covered, so that you're making sure that each patient is getting a full coverage and you're not forgetting anything. So this can include things like treatment options, from drugs to healthy eating and exercise, and places where you want to be able to not just say, oh, you should be eating more broccoli and you should exercise more, but also providing, you know, a list of places or coming up with ideas for how you can actually implement these things. I know at Tulane we have the Goldring Center for Culinary Medicine, which provides healthy eating options at an affordable price for patients. And all those recipes are available on their website for free. And it teaches patients how to cook and use healthy food options to help manage things like diabetes or hypertension or anything else. Making sure that they understand why what they're doing is important and how they can make changes to their plans, and how to detect and understand, like, you know, when they're getting too low or when they might be too high, and what to do in those cases. So individual care is about making sure that what you're telling a patient is different depending on who they are. You know, paying attention to someone's age, their cultures, their literacy, their readiness to learn, what their family support is, what their financial status is, all play into how their care should be delivered. And asking your patients what is it that they need from you, because what one person needs is going to be different from what anyone else. You want to be providing ongoing support and communicate throughout the process with your patients. So, you know, some people might need more support. You know, they might need visits every month, whereas somebody else can come back every 6 months or 3 months and get the same outcomes. And then you want to be evaluating the progress of patients and using how they've been doing, like whether or not their A1C is going down, or how they're if they're losing weight, or even if they're not, you know, like using the small goals that you set at each appointment to evaluate what's working and what's not, and encouraging them not to be discouraged, and, you know, seeing how adherent they are and what needs to be done to make things work better. And then all of this feeds back into quality improvement and making sure that, you know, you're constantly trying to improve your process as things go on, using the data that you collect to implement new strategies and offerings, and then using that to feed back and see what's working, what's not, and not being afraid to make changes and evolve. So that's it for today. It's a little brief, but I just wanted to thank Shannon for all her support and everything else. at the LPCA for everything they did for me while working on this, and I'll take questions at this time.
Oh, thank you, Erin. You're very welcome. At this time, all lines are unmuted for questions. If you have a question, please feel free to ask at this time.
Hi, Erin. I have a question. Where can I go for more information on becoming a certified educator?
Okay, so the certified educator stuff can be found at www.ncbde.org. So this national certification for the Board of Diabetes Educators. And then that's where you'll find the curriculum needed to take the exams later on.
Okay, thanks. And I was also wondering what other resources are out there for patients to access?
So I have a list of that. So there's a number of support groups across the state. The American Diabetes Association of Louisiana has a lot of great stuff on their website. And there's a pamphlet that'll go out today that we put together that also has a lot of information for patients and what they need to be looking out for and where they can get more assistance. There's also prescription assistance. Louisiana has a partnership where, you know, when you need some of the newer drugs or some of the other ones about getting, or for needles or for glucose strips, and that patients can use as well.
Thanks. And could you talk a little bit more about the pamphlet? What kind of information does that have?
So the pamphlet has a lot of information about the different complications of diabetes, and then also outlines a lot of strategies for prevention, and has some other resources where patients can go and find more information.
Okay, thank you.
Okay, and again, if anyone else has any additional questions, please feel free to go ahead and ask at this time. We have a couple more minutes. We'll go ahead and hold the line open just a few more seconds for questions. Okay, well, it doesn't look like we have any questions on the line or in the chat box. So if there are no more questions, I would like to take a moment to thank our Tulane University School of Medicine student, Erin Trudeau, for conducting this presentation today. We will send out a copy of the slides to all attendees and post the recordings of this learning session to the LPCA website. And this concludes our Diabetes Clinical Guidelines webinar. Thank you again for participating. Have a great day.